Yeah, at that sign there. Okay, great. Hey, welcome Team Whidbey to a quick, almost no notice town hall. Obviously to cover health protection condition Charlie, which we entered into last night. So today is Thursday, the 19th of November, and so we went into HPCon Charlie midnight last night, and so we pushed out what the services look like and all those kinds of things. And so I just wanted to take some time to go through what it means. So real quick, we're just going to see if we're getting sound, and maybe we can get a little hi, how you doing from anybody out there if you're hearing, or if that's just an internal problem we have. Okay, so we're getting some good thumbs up. It sounds working. Okay, great. Thank you for that. All right, so let's jump right into it. Obviously, we've been seeing this across the country, across the around the world. We've seen, you know, our region, Europe, around Naples, headquartered around Naples, and the measures they've gone back into. And so we've been watching this creep this direction. And so certainly here in Island County, Skagit County, and the others where our folks live, we've been closely monitoring this situation throughout. And so, so here we are in Charlie. So what's that mean? So first of all, the one thing I want everybody to understand is, because yes, we were in Charlie back in March, April, May, all the way till the middle of June. And then come middle of June, around like the 17th of June or whatever it was, we went into HPCon Bravo and reset stage 2 on our services. We're in Charlie again, but it's different than it was back then, okay? Because we're in what we call decoupled situation, which is where we're allowed to keep services open. The reason why is because we can have measures in place on the installation to provide services as an outlet, as an opportunity for those that we can let in and do that. Obviously, the primary customer base we're looking to support is the active duty military, and then of course wherever we can, supporting the dependents and retirees and other affiliated personnel as well. So that's the general mindset. Yes, we're in Charlie again, but we're decoupled so that we can offer some of our services in reduced capacities, and we'll go through that here in a second. What I'm planning on covering here is I'll talk about the reset stage that we're in with decoupled services and what HPCon Charlie means. A quick refresher on that stuff. I'm going to talk about the clinic and what they're offering for testing and services. I'm going to talk about travel and restriction of movement policies, and then I'm going to talk about some other subjects like housing and schools, emergency preparation, and we're going to finish up with mental wellness, as that's obviously a big issue, a big concern of mine and many, is mental wellness, mental health of our personnel, our families, as we go into this wintertime, into the holidays, with travel restrictions, with restrictions on our day-to-day life, and certainly, so we'll talk a little bit about that coming up. Okay, so starting off, just a quick little bit of background from the stuff that I get periodically, daily, weekly. We look at this stuff. So here's Island County. How's that looking, Tom? Is that about right?
Yeah, that's good.
Okay. So the big things there is just, you can see the case count as we're tracking through this. This covers throughout the entire pandemic, and so you can see the different amplitudes there. So this, you know, this was back in the springtime when we had that carriage facility issue that compounded a lot of what we were seeing early on. Here was the summertime, little peaks, and here we are now. And so not good trend here on little Island County when it comes to coronavirus. So, you know, Skagit County has similar situation with obviously not a big peak because of what we saw. There's a different axis here, but you can see comparison-wise the springtime, the summertime, and now here's where Skagit County is as well. So certainly higher number of cases documented. I'm not going to get into all the different theories on why that is with the prevalence of testing and all that kind of stuff, but that's some of the reality that underlies what's going on around us in our communities. One of the issues that we have more recently when it comes to cases on NASWI with NASWI affiliated personnel, including dependents, is the number of cases where our contact tracing doesn't define where that person got COVID. Okay, throughout this whole time, it was a pretty low number, which means that we were usually quite certain where the person got COVID. But more recently, in the last 2 weeks, half the cases, we're not even sure where that person got COVID from. And this also aligns with some of the stuff I've been reading out there in the media and stuff. Take that for what it's worth. But anyway, that coronavirus is it's more prevalent and more pervasive throughout our society now. And so it's a concern. Now, it's, again, just like I've said in I think pretty much every town hall, but certainly the first one is we have to be very stringent on our policies because of the mission assurance that we have to provide for our deployed forces. Our forces have to be mission ready. We've done multiple deployments and homecomings throughout this whole time. We've got one squadron in pre-deployment sequester for an upcoming deployment. And so we have to make sure that our warfighters are able to get out there and do the job that the nation needs them to do. And so that's why we really need to take some very stringent precautions to make sure that we're inoculating our flight line and our operational forces from this threat. And so that responsibility to do that is not just incumbent upon the installation providing services, it's not incumbent upon the service members themselves alone, it's incumbent upon everybody who supports them, including family members, and that's why we really need your support in this. So, HBCon Charlie, just as a little bit of a refresher, is we're just going to run through some of the highlights for you. Canceling unit and installation sponsored events and large public gatherings. Issuing instructions to personnel to avoid large public gatherings and practice the physical distancing that we've discussed many times. Maximize telework for telework ready employees. Can't telework air traffic control and rents turning and security and stuff like that, but there certainly are people who can telework, and I'm one of those, and I do that at least a couple days a week to minimize that risk. Rescope, modify, delay, or cancel any upcoming exercises. Not so much of an issue for us at the installation, but certainly it can affect some of our squadrons and commands around here. Let's see, case-by-case basis of leave and travel. We'll get into leave and travel a little bit later. Coordinate with state and local authorities to synchronize self-monitoring guidance for personnel returning from high-risk locations. Assess travelers. Let's see, physical distance of at least 6 feet. In 15 minutes. And recall now that 15 minutes is a cumulative 15 minutes over 24 hours. So this is one of the issues that we see is the increasing number of ROM personnel. We are also housing both on the installation and at their housing locations. So ROM, restriction of movement. And so whenever somebody's positive, we do contact tracing. We define who the close contacts are, and then they need to self-isolate or ROM for a 14-day period to see if symptoms are going to develop. And there's also testing in there as well. And so everybody needs to approach their interactions throughout the day, keeping that in mind, so that if one of the people who you're interacting with ends up becoming positive, and 2 days later you get informed, 4 days later you get informed that you were close contact with somebody who ended up being COVID positive, and then you need to protect yourself from becoming that close contact. Okay, you need to always be thinking about in your interactions, am I accumulating 15 minutes of time close contact with that person in that 24-hour period, and is there a reason why? Now, granted, everybody needs to be wearing cloth face coverings and approved cloth face coverings, not with the vents and all that kind of stuff. But even with that, we need to make sure, if there's a reason why, because, and we have some other mitigations in place, but, there's maintenance actions on an aircraft and it's longer than 15 minutes over that shift that you're close contact, then, that is what it is. We need to support the mission. But really, other than that, is there really a reason why you can't maintain that physical distancing so that you don't become a close contact if that person is positive? So in addition to the physical distancing, cloth face coverings, everywhere on this installation, you should be wearing a cloth face covering unless you're alone in an office and there's no chance of you interacting with somebody that you can't put your cloth face covering on before that interaction. If you are alone in an office and you can take that off, great, take a break from it. But if you get up and you go to walk somewhere, put the cloth face covering on so that we make sure that we take that measure. Washing hands for at least 20 seconds, all those kinds of things that we need to be doing are important. Okay. Don't gather in groups over 10 people. That's for like official training. We need to try to limit our training and meetings and such to no more than 10 people, and only if that can reasonably be accommodated in that space. In addition to that, we really need to take on board the virtual options for doing meetings and training and things, and especially as we get into the season where we typically see entire command safety stand-downs, we need to deliver the material, but we need to do it in an appropriate way, and we're working with commands on how to do that. And then limit travel to, from place of residence, work with stops only for essential business. So food, medical, gas, child care services, those are the things that are kind of listed there. And so that stuff still applies now that we're in HBCon Charlie. So service members are prohibited from visiting, patronizing, or engaging in the following installation-specific facilities, services, or activities: recreational swimming pools, gyms, fitness facilities, exercise classes, saunas, spas, and salons. I realize that some of these things are closed due to the governor's order, but I'm just reiterating what the general policy is. Tattoos, body art, piercing parlors, barbershops, hair, nail salons. So that's what the Frago says on these things, that we need to not be doing these things. Now with the decoupled services, we are providing these services on base. I don't think so much the piercings, but anyway, and the tattoo parlors. But we are providing those other services on base for barbers, beauty salons, all that kind of stuff. No dining at restaurants. That's changed outside the fence line anyway. Bars, nightclubs, casinos, etc. Any events designed to promote large gatherings. Okay. There's some other things to the maximum extent practical you need to minimize unnecessary. I'm not going to continue droning on about this stuff, but really you just need to take the mindset of every interaction you have out in town. Is this an essential interaction? Do I need to do it in the next 3 to 5 months or whatever it's going to be? Or can I put it off? So let's talk about that mindset. The governor's order is to December 14th. And so there's also a region directive. That's the one that put us into Charlie, and that was in coordination with all the installations here. But what's the end date on this thing? I've got my own personal opinions. I don't think that there's an official position. I will tell you, we'll continue to evaluate the services to see where we can expand services. If I knew where all the contact tracing was leading to COVID cases, if I knew where all the COVID cases were coming from, then I could really target which services I could open up a little more and which ones that we need to restrict. But unfortunately, with half of our cases with an unknown origin, it's really hard to narrow that down. So we're being a little conservative on our services right now, but we are offering more than we did at the outset. So the point is, what's the end date? I'm hopeful that by the middle to end of December, things can be relaxed a little bit. I'm not optimistic at all. And is it going to be when a vaccine arrives? Is it going to be when springtime rolls around, or late spring? If we look at what happened last year, certainly with the 1918 flu epidemic, the second season was much worse than the first one. And so I personally and my family are braced for impact and we're trying to take a very cautious approach to how we're navigating this. But like everybody, we also have our own particular situations. We'll talk about schools and childcare and all that kind of stuff. And so the Washington State guidance, you know, it's all out there. We have looked at this. I'll talk about a couple things that are not aligned with how the state is administering their stuff, and I'll get to that in a couple minutes. But you can obviously look that up on the Washington government website. Okay, so the region directive is, and the Washington State guidance on who can I have over for Thanksgiving dinner. So basically, the region directive is still no more than 5 from outside your family at any kind of social gathering at your residence. We are also fall under the Washington State policy. So that no more than 5 is for outdoor only, no indoor gatherings. One of my big concerns going into, one of my big concerns going into this holiday and with Thanksgiving next week are, as an example, 1,600 some single sailors sitting in the barracks. A lot of them, well, not a lot of the 1,600, but we have a lot of people on restriction of movement for various reasons. But there's a lot of single sailors. We get over 40,000 new sailors every year in the Navy. Some of them come here to the installation. This is their first Thanksgiving really away from home. And there's restrictions on being able to travel back to family and all that kind of stuff that we need. We need that connectedness with family. And so now, how do we get, you know, normally we have big kind of Thanksgiving, on Wednesday, commands will do Thanksgiving events and all that kind of stuff to really bring those sailors in. That's going to be a huge challenge this year. So I really need supervisors out there, deck plate leaders, LPOs, chiefs, division officers, to think creatively about how to keep those sailors connected, part of the team, throughout these holiday seasons. Couple options. If you can meet the criteria to have an outdoor event and have a couple of your teammates over, then please consider doing that, do it appropriately, all that good stuff. If you can't, or if the weather's just going to be really horrible and you can't do an outdoor event, you know, put some plates together. You can deliver Thanksgiving meals to folks who are in the barracks. And so I really would appreciate our Team Whidbey effort in trying to take care of that, but that's really got to take place at that team level, at that division level, to make sure that we're reaching out and taking care of all those single sailors and other people who need some help through Thanksgiving and certainly into Christmas and the holidays. Okay, so that's that. CDC recommends no travel or visiting family for Thanksgiving. Okay, so yes, so that's a little teaser for what's coming in my little travel section here. Let me get through some of the reset services here. So, by the way, a lot of this stuff is spelled out in what almost everybody on the installation, depending on your command, but I think most of them did it, signed. Everybody should have signed this page 13. And so this page 13 at the time was middle of June when we were going into HPCon Bravo. But also, conveniently, because we felt that we were going to be into an elevated HPCon at some point, which is Charlie at this point, we added paragraph 2 in the back about what's expected of everybody in HPCon Charlie. So anybody who signed that, you know, everybody should be getting a refresher on what that means, but everybody did sign that, and you can be held accountable. So, speaking of being held accountable, yes, there are sailors across the installation who've been held accountable for breaking rum and doing stuff like having too many people over and causing a little COVID cluster. So, we're not sending security out to break up barbecues or to bust into somebody's house if we see thermal imaging that has more than the appropriate number of people in the house. We don't have that technology. We're not going to get it. You know, we don't have tip lines coming in and knocking people's doors in for that kind of stuff. But what we do have, like a lot of things, is we have authority after the fact. If somebody's positive and the contact tracing and we we figure out that there's some nefarious activity going on, then we do have the opportunity to hold them accountable. Additionally, when you come on the installation, you get your ID card scanned. It's not just so we can get some funny little noises and act like we're high tech. That scanner does pull up information, and including whenever we have people who've been on a ROM, who are placed on a ROM status, we put their names in the system. And yes, we have caught people returning to the installation when they should be on ROM. So therefore, they are taking a mass. We've had quite a few of those who've been reduced in rate, put on restriction, which is ironic. You have 14 days of ROM, you get through 14 days. If you can't hack it and you go out and you get caught and you get put on restriction, that's 45 days of restriction. And oh, by the way, you've been reduced in rate. You might have lost half month's paid by 2 months. Whatever the commanding officer feels necessary to award for punishment. So something to think about when you get placed in ROM is you can absolutely be held accountable for your actions. I will tell you, I cannot bring spouses and kids to mass and hold them accountable. But really, if you're not supporting your service member in these policies and you are influencing them to go the wrong direction, then that service member does risk the possibility of losing money, losing rank, being demoted, and being on restriction. So think about what you're doing and think about the effect it can have on your service member and your family if they're not abiding by policies. And like I said at the beginning, this really is an all-hands effort here to maintain the mission assurance of the installation. Okay, and the commands. So let's talk about some services. Okay, this is on our Facebook and website?
Facebook's.
Okay, Facebook. I still want to find a way to get this on the website because I know not everybody's on Facebook, okay? We're not ready to, but we need to make it as accessible as possible. So let me go through some of the things. I'm not going to read it all, but for food and beverage services on base, the only place that you can do sit down is at the galley. And the reason we can do that is because we have authority at the galley, because it's only active duty who are going in there to eat, so we can give them orders and stuff. And it's only one person per table, well in excess of 6 feet between. Because one of the places that we have seen in our contact tracing, and certainly outside in the public health circles they've seen, is you get a few people around a table, they have their masks off, they're eating, spewing their germs all over each other, and next thing you know, we got COVID flying. So here at the installation, galley, it's 25% capacity as a normal galley, but only one person per table, and so we can do that. The other reason is because we do have the barracks there, and so I really want to give our barracks sailors somewhere where they can sit and eat instead of just having to always go back to their room, possibly with a roommate. So anyway, so the galley you can sit down, and otherwise all the other ones are takeout only or drive-through for Wendy's. For some of the MWR services, really continue to be impressed with what the MWR staff does to try to provide services. We had a great Spooky Trails. I know my family and I really enjoyed the Spooky Trails thing that they created, and so we look forward to some of the wintertime activities. December 3rd, we're going to have some kind of virtual tree lighting and something, and we're also looking at some options for some appropriate ways to give people an outlet to celebrate. So more information on that. Check your Navy Life PNW app and the Navy Life PNW website. So meanwhile, Liberty Center is open with modifications. So again, I really want to make sure we're providing appropriate opportunity for our single sailors to have something there. And so the Liberty Center is open with modifications. The theater. So this is one, like I said earlier, we are not aligned in some ways with the state, and this is one of them. And that's because, again, I have more opportunity to institute protocols, and so and just like the governor was asked in his press conference last Sunday, when one of the reporters asked him about how is it that you can cancel all sporting activities, but the Huskies and the Cougars and Seattle Seahawks can play football? And as he said, they've got stringent protocols in place to be able to do that. Likewise with our theater, with decoupled services, I want to try to provide services as we can appropriately, and I've got good confidence in the theater. We have reduced capacity even more, so we've spread out those family groups even more, but you should only be sitting with your household members. And of course, you can take your mask off when you get to your seat so you can stuff your face with popcorn and all the other stuff that you want to eat there. And then, but otherwise, when you're transiting and you're in the lobby, masks on, and stay, even though your masks are on, stay greater than 6 feet apart from each other. Let's see, so that's 15% capacity. Fitness center, it's active duty only. I would really like to see if we can get to dependents, maybe retirees, but we're not there right now. That's a higher level policy that makes it active duty only. Obviously, again, recall last time we couldn't even open it up to that, but we will continue to reevaluate that to see if we can offer some fitness opportunity. Out on the outside, it's no indoor fitness, only outside, and so we're working on it. Convergence zones closed, appointment only for rentals and like lemon lot signups. Fleet and Family Support Center hasn't really changed from what was before Charlie to now, so same services there. The Hunt indoor amenities are still closed, the indoor amenities. And so let's talk child and youth program. So we've gone into HBCon Charlie, but that has not affected our child and youth program from Monday to today, okay? And we continue to try to see what we can do to even expand child care a little bit more. However, we do have empty spots each day, so I'm going to give you some tips here. So our child development home program has some limited spaces available for temporary COVID care. What you need to do to get on the COVID care wait list: log into or create your militarychildcare.com household account. Go to types of care needed, select all options, including temporary COVID care. Do not take any other options you've already selected, just add this to your type of care. Select all FCC and care options, and your household will be added to the CDH provider's wait list. Right now in CDH, we have 20 spaces we can fill temporarily while we are in COVID, however long that lasts. Okay, so this we're gonna hang that on our sites and stuff, put that information out there. But there are some child development home sites that we can offer. So we're just because we're in Charlie, we're not changing any of the tier structure and all that kind of stuff. So everybody who's in care right now is going to continue to be offered care. So you can, and also, as always, we're looking for additional spouses, anybody interested who are interested in running their own business to be CDH providers. So again, maybe like P&W or the Fleet and Family Readiness on Facebook. Okay, and also, by the way, just to highlight all the great work that our Child and Youth Program staff has done. So those at the beginning of this academic year, our kindergartners were still located at the Regatta CDC. We've been able to work them into the school age care program at the youth center, which is really great. So now they've moved up there, and so we've got a great youth center staff, great school age care program going on appropriately throughout, and so that's good. Okay. Plus also we've expanded back into the Clover CDC, so we're using that facility again. We potentially have a little more room to grow, but as always, we are very deliberate in that process, and so we'll see what we can do there. Let's see. Gallery Golf Course is still open. Enjoy those cold, windy days if you want to get out there and play golf. That service hasn't changed. Housing office service hasn't changed, still appointment only. School liaison officer service hasn't changed. She's awesome, Patrina Murphy, if you haven't met her. She's really great to have on board, but she's phone and limited face-to-face. For lodging, Navy Lodge is official travel only, and then the Navy Gateway Inns and Suites, no Space Age travel, official business only. NEX and commissary. So big month for the NEX, just like a lot of retail out there. Retail is going to really suffer this year, potentially. Obviously, e-commerce is going to be picking up a lot, but NEX already, you should have been seeing the advertisements for the sales. They're trying to stretch the sales out, do more online stuff, so they're trying not to instigate a big waiting line of people trying to get in for some Blue Friday deal or something like that. So you'll have to go to the NEX materials for more details. But what I will tell you is that we've been working very closely with our general director and our store managers here on the NEX to make sure that we're handling this sales season very appropriately. We're reducing capacity at the NEX, and with that reduced capacity, just remember, if they have some 5:30 sale or something like that, which I think that they're going to do, that you're probably going to be standing outside waiting for your turn to go in, 6 feet apart, physically distance, all that kind of stuff. So check them out online, and they're offering deals all the time, so I definitely recommend that. The barbershops aren't changing from what they were at the beginning of the week. Appointment only. Phone numbers are on this thing. And tailor shop, dry cleaning, gas station, all that stuff, nothing's changed there. Okay. Commissary. Reduced capacity. Okay, we still have the early bird hours, Tuesday, Wednesday, Thursday. And so we're still doing that. And the early bird hours are for anybody who is compromised, okay? And it's up to you for what that condition is. We're not going to go around asking you to provide medical records and justify that. That's on an honor system. And also, I get that, you know, if you have young kids, your spouse, your service member spouse is deployed, and you've got an immunocompromised system or whatever it is, then you need to be there in those high-risk hours with your kids there. I get it, okay? And I hope that other people are tolerant and sympathetic as well. But just, you know, having underlying health conditions, having immunocompromised system, whatever it is, doesn't look like one thing, okay? So we all need to be understanding. We all need to use our honor on that system. And certainly those folks who qualify for that should take advantage of it. Otherwise, we are reducing. We're down to 100 shopping carts, ID cards only. So no guests. Now, if you have a caretaker who you need to bring with you to help you shop, then we've set up a system now where you just go to the store manager on duty and let them know that you need to have this person who doesn't have an ID card with you, and they'll be able to give you a letter they can sign by direction from me, so that you carry that letter with you anytime and just come right up to the door, show the ID checker that letter, and they can escort you in to help you with your shopping. So hopefully the first time you go through that is a quick process, and from that point on, you don't have to worry about it. You just show up and do your shopping. Gates, I know there's some people who want Saratoga Gate open, but with us going back in HB Charlie, that's extinguished any hope of that anytime soon, as I continue to try to make sure that I appropriately minimize the impact on security and opening gates appropriately, but we'll continue to evaluate that. Let's see. Hobby shop still open, active duty only. Cliffside RV Park, active duty only, etc. Chapel is available. They're open. Okay, we'll get into mental health here, but they're one of the 3 main resources on the base for that. Great staff there. Dial a chaps 257-2414. If you ever need to reach out, that's active duty, dependents, whoever. Okay, if you need to reach out, call 257-2414. A chaplain there can help you out. All right. All that's on the website. So, back to the commissary real quick. Yeah, the shelves have not been fully stocked throughout this thing. Okay, we've had our really hard points where the logistics have really suffered across the country, like when the chicken processing and meat processing plants were really at hard and stuff like that. I did again see some stuff out there in some Wall Street Journal article I was reading about how the meat industry is poised to be much more resilient throughout this, that we shouldn't have those disruptions, so we shouldn't have a run on products. But the challenge we continue to have is we are out here on an island, and our 2 distributors have not been providing enough quantity that we've needed. So that's why we're still seeing, and I shop there, that's why I'm still seeing challenges there. It's not due to our staff, it's not due to our management there. We are really trying to push as much as we can to get better deliveries of the stuff that we need to be getting. But we'll continue working through that. Okay, and let's see. So if you don't comply with those policies at the commissary and NEX, I can sign a letter that says, hey, you're not allowed there anymore. So please be kind, be sympathetic, be empathetic for our staff who continues to work at these places, doing the best work they can to provide these services so we can all work together to get through this period. Clinic services. So somewhere here. All right, let me go through what our illustrious FIO, best FIO in the fleet, has sent me. All right. Symptomatic? Question mark? Please call Nurse Advice Line, the Puget Sound Military Appointment Center, PSMAC, or the clinic to talk to a nurse or schedule a test to be seen or be seen by a provider. Are you concerned you're a close contact and require testing? Call one of those again, the Nurse Advice Line, the Puget Sound Military Appointment Center, or the clinic. All close contact testing will occur after 1300. And this is Monday through Friday. We don't have testing on the weekend here on the base. And I'll talk about some other opportunities in town here. So, your close contact, okay, you're going to self-isolate for 14 days. The only reason to break that self-isolation is to then come in pre-coordinated with the clinic to come in after 1300 to get your test done. And then you go back home. You do your test. 3 days later, if you haven't heard anything, go to MHS Genesis and log in to your MHS Genesis account, which everybody should have, and you'll get your test results, and that'll confirm that it was a negative test, okay? Because if it was positive, then you get a phone call, okay? So that's how that process works. And then, so, the Puget Sound Military Appointment Center, 800-404-4506. The Nurse Advice Line, 800-874-2273, option 1. So, available testing in town. Skagit County, well, let's start with Island County. That's where most of us live, okay? If you have COVID symptoms that are mild and outside of using our clinic, then you can call the Whidbey Health call line to schedule a test, 360-240-4055. And they're open and testing occurs weekdays 8 a.m. to 5 p.m. So really, in my mind, first option is the clinic, okay? That way we can share data easily, but we also share data. But if you get tested out in town, just a reminder, it's incumbent upon you to notify your command that you were tested and then what the result is. So you got to call and register for the Island County stuff for the Whidbey Health if you're going to do that. And then at any time, if you have symptoms that cannot wait, you need to go to the emergency room. Go down to Whidbey Health and go to the emergency room. Call them ahead of time, by the way. So for Skagit County, if you have COVID-19 symptoms and want to be tested, Island Hospital Walk-In Clinic, 8 a.m. to 5 p.m. daily, 360-293-3101. If you're asymptomatic and you want to be tested for close contact, potential exposure or something, then you can go to the Skagit County Public Health drive-through testing site, and you have to be a Skagit County resident to do that. It's Monday to Friday at the Skagit Fairgrounds. All right. And then there's also the Skagit Regional Health Respiratory Clinic over in Mount Vernon. So that's where really, if you're on the weekend and you absolutely positively have to get tested, but it's not an emergency room thing, then you need to call TRICARE, and then you need to go to Skagit County Regional Health. And so, by the way, Skagit County Regional Health also has an they call it e-clinic. But anyway, you go to their website, they have a e-clinic, and really good process, $40 for a doctor visit. So if your kid's got like an ear infection or something like that, and you don't want to go to a clinic or hospital, you can use that service. I don't think the $40, I'm not sure if TRICARE covers it, but I have had to use that on the weekend recently for non-COVID stuff for my dependents, and it was really good. So, okay, so that's that stuff. I'll see if maybe XO can type some of those phone numbers into comments for that. All right, so that's clinic stuff. All right, that's for a little bit later. How are we doing on time? All right, we're doing okay. Okay, we took care of that. Is CYP going to go back to pay-as-you-go? This is from Matt. I don't think it's from me, Matt. It must be another Matt out there in the world. So thanks, Matt, for the question. We are not planning on doing that at this time. We're planning on staying with the same system that we've developed. So really, again, like everything else, really need that coordination between service member and supervisor, whether it's a division chief, LPO, division officer, whatever it is, on what your work schedule is for those 2 weeks, so that you can then submit your child care plan to CYP, so that we can make sure we accommodate your plan, and then therefore we can also accommodate other people who need those spots. And then once you commit to that plan, and commands leadership and deck plate leadership needs to understand this, once you commit to that plan, then I intend to hold you financially to that. You pay for that 2 week period, and then lather, rinse, repeat every 2 weeks. So that's the plan. I need to make sure you're sticking up with that. That really allows us to have stability for our staff, stability for our kids, and then stability to be able to allow some of that kind of day-to-day when people need that child care assistance. So thanks for the question. Great question. All right, schools, I mentioned are grade slow, but yeah, I've had the benefit of having my 2 boys in school in the hybrid model, and November 14th, I think, was the day where we were supposed to go to 4 days a week. Obviously, that didn't happen with the rates we're seeing per the school board approved phasing plan. And so now their next evaluation, I think, is December 8th, where they'll look at the 4 weeks back. And if we don't hit the numbers, don't quote me on the numbers, and I'm not going to say them, but whatever the numbers are in their plan, if we don't hit that 4 week average, then anticipating around December 14th, I think, is the date where we're going to go back to distance learning. If I had to put money on it, I've already got my family braced for impact with us having to full-time distance learning at home. And so, again, hopeful but not optimistic that it's going to go, that they'll still be in school. So that's where we are. Anacortes, I think, is still completely distanced and such, and Coopville's doing their thing. And so basically, we're looking at January through who knows when, being back that direction. So schools, that again is something where we really need to accommodate that and the strain. So we'll roll all that up in just a second here. We're going to take a quick detour to the recent power outage, and then we're going to finish with mental wellness. Any other questions coming in that would be relevant before I go into that stuff?
So it might fit your travel discussion, but kind of
okay.
General COVID piece to it.
Got it. Yeah, travel. Okay, Rahman family. Can kids go to school or childcare? Yes. Yes, kids can go to school and childcare as long as those things are being provided. Okay? Oh, but Ram, so that's the difference. All right. So, let's talk a little more about Ram, then we'll talk travel, and then we'll get to those other subjects. So I talked about, and you can end up in ROM for close contact. You can end up for precautionary ROM due to travel. You can end up there for pre-deployment sequester is a different issue. So there's a variety of reasons that you can get into a restriction of movement. And then you get into the isolation and quarantine when you're actually like more towards the COVID positive thing. So let's say you were a close contact. Okay, you've been notified. Hey, you were in close contact with somebody 3 days ago, and now you need to self-isolate and ROM. And you live in a house. You've got family. Your kids go to school. Here's the expectation. The expectation is two options. A, you self-isolate in a room and you don't interact with the family other than them shoving pizzas under the door and whatever else you need. And if you can do that, then more power to you. That gives your family more freedom to go about your business. So one of your questions is, well, my close contact was 3 days ago. Why don't they have to self-isolate too if I've been interacting with them? Well, in our processes, we look at who the close contact is. If that person who was close contact had close contact with other people, we're not there yet. Okay, we just focus on swarming on the close contacts. Okay, so we self-isolate, we test, and then if test is positive or if you become symptomatic, then we do the contact tracing and swarm on them. You know, you could be really conservative and just isolate close contacts from close contacts, but now we're really shutting things down a lot of the times unnecessarily. So back to my point. Option one, you self-isolate and your family takes care of you in that self-isolation, and then they're free to go to school, child care, spouse can go to work, all that kind of stuff. If you can't do that and you choose to self-isolate as a family, then the entire family needs to self-isolate, okay? Because at that point, if you do end up becoming positive, then you have not minimized the risk to them, and so therefore we need to be conservative and make sure that your kids are self-isolated with you. So that's a personal choice amongst families, and then and that's how you need to approach ROM with families. Okay? So thanks, great question. So now let's talk about travel. So first of all, on travel, there are policies, and all this comes down to the command level. So you need to be talking with your command about travel. And obviously that's forefront on a lot of people's minds as we go into the holidays. There's certainly one command in particular, VAQ 142, which has more urgent things forefront on their mind as they're going through pre-deployment sequester. And I can't talk about that because I have seen out in the press that TR, the news of TR deploying again is out there. And you know, as we talk about these issues, just put yourself in the shoes of those sailors who are deploying on TR, VAQ 142 included, coming up here. They're pre-deployment sequester over Thanksgiving with families right outside the fence line and other families around the country. And they're going back out there to sea just before Christmas. And the nice thing is, I hope that when you all come back, I hope that we're in a much better situation in the middle of 2021. But God bless you for getting out there and doing what our nation needs you to do. So with that in our mind, let's talk about life back here at Whidbey Island as they go off over the horizon. So yes, command level for travel. We're following the intent of the governor's policy. Governor's policy is basically if you're coming from out of state, then you need to, in our words, for 14 days, you need to self-isolate. So we got to build all this into our leave plans. Okay, we can't be absolutely restrictive and say nobody can go on leave, but we need to look at a case-by-case basis and really see if it's the smart decision to do this year. I really want to see my parents and my family. I want to take my family places, but for us personally in our family, this is not the time to do that, and we're going to continue hunkering down as long as it takes to get through this. And but as I said at the beginning, my situation is different from other people. And so we need to acknowledge that and work on a case-by-case basis. So even travel in-state. Let's look at the latest weekly travel planner map. This has been a variation of stoplights in red, yellow, and green, and we're almost entirely red across the state now for all the counties. We got a couple counties that are holdouts, but the trends in Klickitat, Wahkiakum, and Okanagan counties are all red as well. So maybe by next Tuesday, we'll see one of these where every county is red. We'll see. And we've got some counties that are way up there. Walla Walla is 440. So they're the winner right now. I think somebody was in the 600s recently in the state. So some badness around. And so even travel in the state is very problematic when it comes to COVID risk. So even liberty is something that you have to approach with this mindset. So certainly, as Theo reminded us, the CDC is recommending against visiting family or for Thanksgiving. Obviously, with the governor's policy of 14 days and all that stuff that goes into that, it's pretty much impossible for I would think for people to visit. And so the other issue that we have is those college kids, dependents who have been in college, who, you know, there are a lot of college kids who parents are spending tens of thousands of dollars for them to do college sitting on the couch at home. God bless you. But there's quite a few college kids who've been out there on college campuses and such. And we've seen the COVID rates on college campuses, what they are in various places and all that stuff. And so some of those college kids are coming back home, okay? So you really need to think very hard about what you're doing there. Are you gonna lock that kid in a room for a day or for 14 days with a PlayStation and ramen noodles? Or, you know, how are you gonna treat this so that you're reducing the risk to the installation, but you're still welcoming your family member back and taking care of them. So that's individual situations again. And if you have a college kid coming home, you probably need to talk to your supervisor and explain to them what your plan is. All right. Yes, you can still do emergent leave. If you have emergency leave because you have a close family member who's you know, terminally ill or God forbid passes away or something like that, then obviously work that out. And in the cases that we've had to go through with that, we can, you know, build a ROM on the backside of that to do the 14-day isolation and all that. So we're going to still look for that with the emergent issues and humanitarian issues. So, all right. One of the things about, and I've talked about this in the past, if you have to ROM for an official reason, like you're at work, you're in your work center, you're doing great work for the squadron, and somebody else is positive and you're a close contact and you have to ROM, and you need a barracks room, but we don't have barracks capability, or you need an NGIS room, but we don't have NGIS, whatever it is, then your command can get you that they pay for you to isolate out in a hotel, and then the command takes care of you while you're there. So there is that. If you go on leave and you're approved to go on leave, and it ends up and you have to ROM on the backside of that, you're not going to be able to get that $100 a night or whatever it is to defray the cost of the ROM. That's going to be on you. So you really need to take that into account as you look at your plans for the holidays. Oh, by the way, in that situation, don't go to Navy Marine Corps Relief and say, I need $1,500 to pay for my hotel because I just went on leave. That's not an option either. Navy Marine Corps Relief is still open. It's still helping service members in need. And we got a lot of service members in need financially, but not in that situation. ROM is also not a vacation, okay? It is, it's not the opportunity to go get a hotel room over in King County and enjoy yourself, or go down to Disney. Obviously, you know, I'm exaggerating, but it's not a vacation either. So do what you can to try to make sure you don't end up in ROM, is my message there. How can we expect to bring numbers down if we keep doing normal operations? Well, we continue. We're never going to get to zero, but we continue to minimize numbers, okay? And as I look at rates here in comparison to rates around the state and the country, we're doing a lot better than others, okay? So, so I would challenge you to say, how are we going to continue to do our mission and be the Navy the nation needs if we don't continue, if we don't keep doing operations. And yes, we've got some commands that are back to doing shifts, blue and gold shifts, working every other day. So we have people working every other day. So we continue to do that. So if you consider what normal operations were pre-COVID, we're not doing normal operations. We do have mitigations in effect. And so I think that's a little off, and we're not operating as we normally did in the past. We're operating with appropriate measures in place, but we're still deploying and bringing home service members as well, because we absolutely need to make sure that we're ready and our forces are ready and deployable around the world. Okay. All right, I think that's it on that stuff. Emergency prep, real quick. We did have that power outage. If anybody was around December 20th of 2018, we had the power outage that lasted a little longer than this last one. We had some residences on base that were out 3 days on that one. I read the article after this one. It was a couple days later in the local paper that said that, and somebody had told me about this when they saw it, is, the power went out that day, went out at like 11:30 in the morning, okay? And the afternoon and evening, traffic heading off the island, north and south, across Deception Pass and on the ferries, according to the article, and because a lot of those people returned, it wasn't just to go spend the night somewhere. A lot of people were going off to get food and whatever else they need. Come on. I mean, you have to be ready for power outages here, okay? You've got to be ready for an earthquake here. You just have to be, okay? You can't rely on being able to head to the store 2 hours after a power outage or something like that. 14 days is what you really should be ready for. You should be ready to exist without outside help for 14 days. If you can't do that, you really need to think through how that's going to happen. So certainly with the windstorms we get, more predominantly in the December into January timeframe, and then the snow events we've been getting, people told me it hardly ever snows at Whidbey. I just don't believe them anymore after being here for 2 winters. And so you've got to be ready for 14 days is what we've been telling you. We live out here on an island. You got to be ready. So please take a look at the NFAS app on your phone. I don't know where my phone is. Must be in the car. Anyway, NFAS app on your phone. It has some Ready Navy stuff. Obviously, Washington State has emergency preparedness stuff. There's a lot of information out there. So please spend some time focusing on that. Don't be a liability. Be an asset. And on that note, if you're a service member, get your NFAS updated in compliance with that. Every 6 months, you got to update your NFAS. Okay, so all that, let's talk about mental wellness, because that is a big issue here. I will tell you, there are some people on the installation who I've talked to, and I think there's quite a few out there who financially are doing better in this COVID pandemic. Okay, they don't have the expenses that they normally have each year with maybe travel that they've typically done, or other things. They're saving more money. That's great. If you're in that category, make sure you've got a good savings plan so you can benefit from that. Okay. The mental wellness of a lot of people cycles up and down depending on what's going on with homeschooling and what other individual factors you have going on. And so my point there is, yes, we've got people like that, but we also have a subset of people who I'm very concerned about, especially as we go into the winter time. Okay, I talked about our single sailors in the barracks. We really need leadership to be engaged and be helpful in appropriate ways to help make sure we get through that. I am really working at ways to provide better broadband capability into the barracks because folks are connected all the time. And oh, by the way, you want to be on those streaming services for entertainment, and you want to be able to, if you can't travel back for Thanksgiving or whatever, you want to be able to have a good phone call, FaceTime call, whatever your platform is, with family to stay connected virtually, all those kinds of things. So we are trying to work on better broadband service there, and anything else that we can work on to make that experience better, please let us know through ICE comments or through your command how we can help out there. We just did a resident satisfaction survey in UH. I will tell you, and it's the barracks, I will tell you that a lot of the numbers have gone up because of the efforts we've been doing the last year, and we're going to keep the push on those efforts because we still aren't where we want to be, and we're going to keep focusing on those efforts like maintenance and response time and feedback for our sailors there and all that kind of stuff, while we take on some renewed actions like really working to try to get better broadband capability in there. I'll also tell you that we are working through the contracting process to bring 5G to the installation, which I'm excited about. That'll be early 2021. It's for mission-focused reasons, but I definitely expect some side benefits there, and so we'll continue working on that project. So, talking finances, one of the additional stressors is this payroll tax deferment, okay? There's a great spreadsheet of ranks and time and service that shows which folks are actually affected by this, but it really does affect a lot of our, I think all of our junior sailors are affected by this. And so, so basically the payroll tax deferment, they saw a bump up in their take-home pay for a few months, but nothing's free. That stuff's coming out of your pay after the holidays at 2 times because they got to catch up. So your paycheck went up, your take-home pay, okay, not your gross pay, but your net went up September 2020. It's going to come down in January 2021. From September to December, the Department of Defense military and civilians employees Social Security payroll tax is deferred until January 21. Beginning in January 21, these employees would be paying double the normal Social Security payroll tax through April of 2021. So it's a 1-for-1, okay? And save what this tax would be now, 6.2% of your base pay, so you have the money to pay your expenses later. Save now to pay later, okay? So you can talk to Kathleen Johnson or Kathy Clark over at the Fleet and Family Support Center as personal financial management. You can call 866-854-0638 or call 257-NAVY. Get on your Navy Life PNW app for a Fleet and Family Support Center. And but really, supervisors need to be sitting down with junior sailors and appropriately, 6 feet distance, face coverings, but talking about this payroll tax deferment, okay? And what they need to do to make sure they're going to make it through April without putting themselves in financial stress. So that's tax deferment. Again, Navy Marine Corps Relief Society is available, and our PFMs at Fleet and Family Support Center for any of these issues, because we've got, now that we're in HPCon Charlie, okay, we had allowed some of our sailors to get second job. We got to pull back from that, okay? Some of our spouses are still facing, obviously a lot of our spouses are facing unemployment and underemployment across the DoD. It's like a 25% unemployment rate for spouses, and so that continues to be a problem that we try to work with. However, within COVID, we all know, especially with where does the distance learning fall on? It falls on the spouses predominantly. I mean, I take a couple days to teleworking to help out with that around my house, but not everybody can do that. I get that. And so a lot of spouses have, and we've seen this across the country, and it predominantly affects women. It's like 94% of women are pulled back from the workforce because of the issue of homeschooling. Okay. In addition to that, just mental wellness overall. Holidays, we all know it's daylight's limited. You got to get your vitamin D, all that stuff. Fleet and Family Support Center. So what the services were going into this new HPCon Charlie is the same, and so we're still working to try to get some virtual telehealth platform for Fleet and Family Support Center. They do telephonic counseling, but we're still working for a better platform for them. The clinic, in their services, they do have a telehealth platform, and so continue to get to those services if you need them, and then also the chapel, as I mentioned. So those are the three big ones. Work with TRICARE. But I say all that, but we all know that we live out here on an island where there's a dearth of these services. So it was a challenge going into COVID. It continues to be a challenge. But please reach out if you need those services to get them. All right. Stay fit. Okay. Fitness centers are closed out in town. We've got active duty only in our fitness center. But the Turkey Trot, 1st to 21 November, it opened up on my 50th birthday, and I celebrated with a 5K run for the Turkey Trot, which, by the way, Alicia, I still need to get on there and register for. But appreciate the opportunity to provide those kinds of fitness challenges out there, and we'll continue to do things. If you have some ideas, please let us know. And then the tree lighting and other festivities coming up as well. Any other questions? Anybody on there other than Matt and a couple others? Yeah. Okay.
A lot of folks on.
All right. Well,
Good chat.
hey, and speaking of which, so we still are having technical issues with getting YouTube lined up to do YouTube Live. We're still going to try to work through that, but we will pull down this video and put it on YouTube so it's accessible to more people. And so if your friends were wondering about that, please let them know to look for that on YouTube probably sometime tomorrow. Okay. And yeah, I think that's it. Last chance. Okay. Hey, great. Stay safe out there. Take care of yourself and others. Use the precautions we talked about. Wear the cloth face coverings, and stay physically distant, but stay socially connected, and continue to try to work through how to do that. Really take care of each other, and yeah, that's all I got. So, thanks.
And reminded if they have any follow-on questions to reach out to PAO.
Great. Any follow-on questions, please send a note to the Public Affairs Officer, and either through a direct message or through their NAS Whidbey PAO email address, and we'll be happy to get you that answer as well. So, okay, thanks.